Number two, changma tashtele, tering sa pupugi, indaingi, tanda chibebelo letengi, tuju de la leson, ani tering azu chibebelo letena lola, indaingi lobju, ngawang hatun la tendi shiye, ani tangbo la tering azu inchilo ay nam yupi lo yora, tering tangbo zo inchilo, ani di jela pege toni logre, chejang tangbo ngola, ani ge zing hatun la dang, ngawang hatun la kirani inchi di go zuro dang.
Thank you, Gyerinshin. Hi, Ngawang. How are you today?
I'm good.
So today we're going to read an article from Time for Kids, and it's an interview with the CDC director. Recently, there's been a lot of new changes and updates to the COVID-19 precautions. Have you heard about those in the news? Or maybe from school?
I heard about it in the news.
Yeah. So today we're going to read this article. I think it'll be good for us and for folks who are watching to learn about the recent changes, especially for kids. Let me just share my screen with you. Can you see my screen?
Yes.
Okay, great. All right, so in this article, it's actually covers an interview by a Time for Kids reporter and the CDC director. So we're going to role play, and I'll pretend to be the reporter and you'll pretend to be the CDC director. All right, so first we'll read the intro. CDC director talks with Time for Kids. TFK kid reporter Jeremy Liu. Spring is here and summer is on the way, but the COVID-19 pandemic isn't over yet. What can we do to get our lives back? When can we finally relax and take our masks off?
Dr. Rachel P. Walensky has some answers. She's the director of the U.S. Centers for Disease Control and Prevention, CDC. Dr. Walensky leads the agency's 21,000 employees who work to protect Americans' health and safety. Before moving to CDC headquarters in Georgia, Dr. Walensky worked at Massachusetts General Hospital and taught at Harvard Medical School. She has spent her life working to understand and battle diseases.
Recently, the CDC announced that kids ages 12 to 15 can get the COVID-19 vaccine. It also announced that fully vaccinated people no longer need to wear masks in most situations. I had an opportunity to talk with Dr. Walensky about these important developments and to ask her questions from TFK Kid reporters.
I learned that vaccinating kids and adults will move us closer to life as we knew it. This is the first time I've ever been excited to get a shot.
Great. So TFK Kid reporter Jeremy Liu. This has been a really busy week for you. I'm excited to speak with you. The CDC just surprised us by announcing that people who are fully vaccinated don't have to wear masks most of the time. Does that mean that if you're fully vaccinated, life can go back to normal?
I think we should first define what fully vaccinated is, so everybody understands. For kids 12 to 18, fully vaccinated means that you got 2 doses of the Pfizer vaccine, and then you waited 2 weeks to make sure you were completely through getting your whole immune response. We have now said that fully vaccinated individuals are safe and can take their mask off. I think it's going to take some time for us to get back to what we call normal, and I think we're probably going to get back to perhaps even a new, better, safer normal. But I do think that this means that we are taking another giant step to getting back to the lives we once knew.
What happens if someone who isn't fully vaccinated doesn't wear a mask?
It's really important to understand that the guidance we put out is about people who are fully vaccinated and that they are protected. People who are not fully vaccinated continue to not be protected. So guidance for them should be 1, go get vaccinated. 2, wear your mask until you're fully vaccinated. And if you decide not to get fully vaccinated, continue to wear your mask and practice all of the strategies. Distancing, masking, hand washing that we have been recommending for months now.
You also recently announced that kids aged 12 to 15 are able to get the COVID vaccine. I just turned 13, and a lot of my friends are eager to get it. Can you tell us more about that decision?
We have known that the Pfizer vaccine, when it was first authorized, went down to kid ages 16 and up. What they generally do in studies is first, they test them in the adult ages. And then they do different kinds of studies to make sure that they are also safe in kids and that kids are getting the same immune response. So we looked at the data with the Food and Drug Administration, FDA, in over 2,200 kids. And they showed that the vaccine was safe and 100% protective. There were 16 cases of COVID in the kids who didn't get a vaccine, and none in the kids who did get the vaccine. And in that context, what generally happens is the FDA goes first. They authorize a vaccine for this age range, and then the CDC comes in with their advisory committee on immunization practices, and we approve that authorization.
Yeah, great. Immunization. A lot of kids have questions. The other Time for Kids kid reporters shared some with me. Rory from California wants to know, what impact do you think expanding the vaccine eligibility to 12 to 15-year-olds will have on the pandemic? And how soon will we see the impact?
I hope it will have a big impact. I hope teens and tweens will be eager to get the vaccine. I have a 16-year-old. I know he was particularly eager to get the vaccine because he was then able to go back to seeing his friends again, to go out again, to feel safer going out again. There are 17 million kids in the US between the ages of 12 to 15, and they are now all eligible to get the Pfizer vaccine.
What if your parents don't really want you to get vaccinated?
That's certainly going to be a family discussion. What I would encourage teens and parents to do is to get more information. Talk to trusted advisors in your community, your
Pharmacist?
your pharmacist, your pediatrician, local health departments, your clergy. Go and talk to them about the benefits and risks of potential vaccination.
Here's a question from Pranav from New York. Do the current vaccines effectively protect kids from new and emerging variants of the coronavirus?
Great question. We are watching these emerging variants very, very carefully. The data out there now demonstrates that all of our vaccines work to prevent against all the variants that we have here in the United States. And we have no reason to suspect that would be different for kids than for adults.
Many of the TFK kid reporters want to know about schools. Here's a two-part question. Sophia from New Jersey asks, how will schools handle some students being vaccinated and some not? And Victoria from Pennsylvania asks, do you think that eventually students will be required to get the COVID-19 vaccine?
Both of those are really important questions. Just as we've released guidance for what you can do if you're vaccinated, we now have to revise our guidance for how schools are going to handle kids who are vaccinated and kids who are not. There are going to be schools with students ranging from before the age of 12 to above the age of 12. And then there are going to be schools that are entirely eligible. We don't have any vision right now that we, as a part of a federal government, will require vaccination. Each city and country will make those decisions. I also want to emphasize that we are not one uniform country in terms of how we are doing in a pandemic. Areas in the country have higher rates of vaccination. Other areas have lower rates of vaccination. Similarly, some areas have high rates of disease and low rates of disease. So as schools are making those individual decisions, they're going to have to look at how their country or city is doing.
Talking about schools, here's another question. Belen in Virginia asks, were there changes introduced in schools during the pandemic that you recommend keeping? What are some examples?
As part of our guidance for opening schools, we've done a lot of work with the schools. We had distancing, masking, cleaning, ensuring hand sanitizers were around, and ensuring that people who had symptoms had access to testing. And we want to make sure that there's good ventilation in those schools. Many of these things remain important. If students have symptoms, they should be out of school and go get a test. We should keep cleaning surfaces in the school because surfaces in general should be clean. Kids should keep their hands clean. They should hand sanitize. They should hand sanitize. That's not just good for COVID, but for all respiratory viruses. One of the respiratory viruses. One of the things that we might be able to relax is if you're vaccinated, you might not need to wear a mask. And you probably don't need to, well, you definitely don't need to distance if you're vaccinated. So some of those things are going to be able to be relaxed depending on the age of students in the classroom, and some of them will have to maintain.
Afton from Arizona wants to know, if I get the vaccine, I'll be vaccinated this summer, but my 3 younger sisters won't. What can I do to help keep them safe?
There are so many families who are going to face this challenge, where they have one student who's vaccinated and younger siblings who are not. That vaccinated student is safe to be out of the house without a mask, but he or she is going to have to promote the safe mitigation strategies that we have been promoting for the last many months to make sure his or her siblings are safe. So continuing to mask, continuing to distance, not being in crowded places until those younger children are eligible for vaccination.
Abby from Hawaii and Miguel from Texas are both 11. They want to know when they'll be able to get the vaccine.
We're waiting for data from the FDA. We started first with the 16-year-olds and then we went down to 12. I think the next bracket is going to be down to 9 and then down to 6. We're really hoping that we'll see some of those data in the fall and that we'll be able to get the age range vaccinated soon.
Belen from Virginia has another question for you. She asks, COVID-19 has been a disproportionate burden on some groups. Can you talk about how you are connecting with and serving people from these diverse communities?
This is such an important question and one that we at the CDC are really focused on. Before I came to the CDC, I was a doctor in a hospital in Massachusetts. We saw how Hispanic communities, Black and Brown communities were hit hard by this pandemic. They had higher death rates. They had higher rates of hospitalization. What we need to do now is to make sure that they have adequate resources for vaccination. We are doing an extraordinary amount of outreach. I'm really pleased to say that just this past week, we put some more data on the CDC website that demonstrates that we're making enormous strides in getting vaccination to the most vulnerable communities.
Great job, Ngawang. So I thought that was a really interesting and informative article. I know one thing that I learned that I didn't realize was that a lot of the safety procedures that we've been doing since the start of the pandemic should still happen, not just because of COVID, but just in general. They're good practices to keep healthy and to keep our environment clean, such as cleaning surfaces, washing hands repeatedly. These are things that I think are going to become more and more of a normal situation. Even as COVID goes away, I think we'll still be practicing these cleanliness practices and sanitization practices in the long run. I know no one in my family has gotten a cold in the last year and a half. And I think a lot of it has to do with the COVID precautions that everyone has been practicing. Is there anything that you learned that was new or interesting to you?
Something that was interesting to me was that they slowly they were starting to get the age range so first it started as only 16-year-olds could get the vaccine, and then it started going to 12, 9, and 6.
Yeah. So soon they're going to be available. Vaccines are going to be available for younger and younger children, right? And so maybe your age group will be coming up next, and when that happens, I think life will slowly return to normal because you'll be protected from COVID. So that's really exciting and something to look forward to, right?
Mm-hmm.
Yeah. All right, great. Well, you did a wonderful job on the English section, and I think a lot of people who are watching learned a lot of new information that's really important to everybody. So I will now turn it over to your Tibetan teacher, Gerin Chinla.
Tujenang ajichiring getring la tujenang angala tentanda kurangi inji tonu logyo ngae pe mangbu sawa dende yo nizu sawa pe mangbu shinsa hashin hama goyo ani tanda nga kurangi inji hangsa ya bo losura ani tanda ni pyu di goma zungola tangi nga kirang ngo chu chera ma sang azu inji thangbo zhe zang kirang thangbo tanda nga zu chongpu chinji mangbu ji da de do ani kurang zo la ngo chu ji shu yin ba
So, dashi de le nge ming la ngang ha tu yi nga lo chu yi nga zin da shi ba yi nge chun da ga shi gar pore ani nge sem jing ga shi jang gi
lo so thje na nga la zhe da nga la zhong wen de chan de tang bo ge ji kra ka ka nga jang du za ma nga ting gi do ani ta na kra ngi ngo zhe che dan re pe ge ja dan re pyu lo dan re de zhe tong du za ma nga ha sang gi du da pe ha le wa re kra ha sang ya ge zhe do ani nga wa kra la chuo tie ji la ta na kra yin de na pyu da pe ge de zu jang ne ra yin de lo tra go zu ne ni kra lo kha zu zhe so kra lo kha du go zu ba ting gi de
nge nga yi ge yi ge
lo didi kyoran gozu du zamba lo ge re ra tanda lo ga zura
lo chu
wow lo ni nang la kyoran ge pyoge da pyu den de yar ge ro kyoran inji da zu da nam gyu ni ya po yo re ang ji da zu ra ene kyoran pyoge da pyu di nyama thang bo gozu de tanda han sa re pe ya po nga mu tu ne kyoran ge shu kya sha lo ya ani nga kira tiri nga zu chokpo cho la nga zu tiri zhongdeb gi min kare re jo shi kare re
shokja thang chema lep
shokja dan chema lep inji to ni gyurna khandis la ga
kites and butterflies
kites and the butterflies ra ani thanda gela I zhongdung gi ra ni krang thonggi de ta sha lo thonggi de
thonggi du
Plus, ani thagaran thanda ngawang gi song na shingi thiri nga zu zhong di gi ming la ra zhong gi khajang di gopje di shokje thang chema lep ani thanda ngawang kirang di gi da ju shi di gang la thanda di shok lep thang bu di gang la thanda minna zo ni do nga thiri zhong dim na gi minna zo ni di ming la ka re
somo thang kando
thomo dang khan ro lo so thuji che ani namgyu na shingi thanda di gi zhongdeb di thanda parjun chinye di suresha
the Department of Education Central Tibetan Administration
Department of Education na shiri lekong ra pe shong shiri lekong gi parjun cheshas ani di zomba bodun zu suresha ti zomba la do de la mingsum da kharesha ngawa
Gyosan Gyotso Tenzin Tseyang
pe bo
Tupten Drupel
tupten chembe kurang zu sumgi pe ya bani dina la la ga chini rumu tingen tupten sanje ani tepsu chugyo ba la do won ti ki editor de thanda buddha kya de mi mangbo ki nyamru ki la ga cheje ani nga zu tep ti tun tu dong kurang zu la thuji che ya ani ta da zhong di ki shogle mo thangbo ti ga la khale du ngawang thonggu da
Nimachi Kando Tang Chomo Nang La De Yu Pare Teni Lopta Kongseng Yin Pare
so nimachi kurani na la de res ani di nima de la konsen res konsen du kurani karichi sha
Kando Tang Chomo Shokja Tongdu Chin Pare Konyi Tang Chenbo Shikla Chin Pare
konyi tang chenpo shikla chimba res ani
Somei Shokja Serbore Kando Shokja Garbore
so kurani la shokja re re du roa chomo shokja serpo che kando gi shokja karpore shas ani
태도 학박엽기 유발해.
아니
부당 부모 가시 속자 동기 유발해.
동기 요바래 동기 말다 동기 요바레스라 데두 푸다 포모 가시게 쇼자 동기 요바레스 키랑 쇼자 당하라 고유야 ngawang
나 속자 나
당뉴야
당요 말해.
알레 키랑 쇼자 당뉴 요마레스라 직체나 제마 키랑 치로도 알아 두두 잠바 쇼자 당하 탑시다나 키랑 가도 호레라 이네 단데 키랑 당뉴 매장 아주 강이 유매 하고 민도아 서 토지제 아니 포모카시 부다 포모카시 쇼자 동기 요레스 아니 크라니 같이자 소무당 간르니
처음에 급에 걸로 태주 바래.
아하
컨두 모랑기 속자 걸고 태남라 땅와래.
그러니 다 쇼자 당할 고주도아 아니 디제라 같이자 동기대 동기민도
컨두 속자 걸보이 급바 텐 바래. 속자 태 바랑라 토벌 팅신예.
쇼자디 파낭라나 갈라 거래 거와
남
남어 파낭라 대신에 딩니 동유레스라 아니 가르치자
부모시기 컨돌라 속자 동록 제바래.
아하
소매이 속자 설보태 양 바랑라 팅신예.
배야보 소무기 쇼지세 보대 파낭라 딩시 로바지 대 포무지 로바지다 혼들라 쇼자 당간라 아니 가르치자
속자니까 바랑 토보라 팅신예. 남가라 속자 망부 유창 닝제부 동기 유바래.
배야보도 아니 단당아와 기랑기 디나 종디기 르무나타나 치우든데 동구도 쇼차메바 디 치우데 밍라 가르라
뚱뚱게나
총총게나 아주 벽이 투모 마연베 치우디로아 아니 그랑기 총총게나 꼴라 가르신겨 ngawang kinzu tanda 게치주이 진나낭라 망부장로
뚱뚱게나기
가왈라유라
그
벼라유르스라 이네 총총게나 디사제 찍라 되기 요르와 요마로아 사자 빼셔나 야가 벼라 대와에나 공가 군주양 가왈라 용결 하고야
그러면
사초 살라마 용교라 migrate 라나 카레 네베치기도아 온디시나 마 총총的就 프리아 빼야 보도스라 쇼제 곰시 아니 총총的대화 요 셰든의 신겨 나와 진짜 진짜나 로라 셰니베 샤데 총총 갈모 디니베 라서 그런 진예를 스터제 나가왕 아니 디제라 같이자
컨도이 속자이 그바 제바래.
읍스 아니
처음에 속자이 그바 양 제바래.
전부 다 간루니가 있어서 구바체도 다 가르치나
속자니까 롱부 타그린 두 게르보래.
케르바레
제바래.
단다 쇼제디 구바체장 아니 롱부 학바잡네라 타랭보라 아니 키체바레스 아니 쿠니기 쇼제라 가르 쿠니 가지니 대샤닌제
코니기 속자라 tenede.
코니기 쇼자라 텐데레사 탁바이기 코라니마 텐투마라 니제 다 코니 동바다다 갈시샤
Koni salade bare. Koni semba shita gyoware.
다야 뭐 코니 셈바 시자 교레자 마살라 데네 아니 마살라 데뒤로 아니 가르통도 직통wen사
Kandu meto gigangla chema lep karpo shitongware. Tomo meto gigangla chema lep serpo shitongware.
배하고 호랑이기 쇼차기 천도다 직박이 체말렙 깔보 직당 체말렙 세부 직통레스 아니 같이도 보니
Chema lep karpo the meto chikne chikla pur chin pare. Kando the jela gyuk pare.
배하고 간로기 다 군이게 체말렙은 좀 사게 찍라 되기 말아서 저 샴바라 줘도 메도 찍니 찍라 파푸르도 아니 군이 체말렙 대셔당 거 줘레스라 아니
Chema lep serpo the meto chikne chikla pur chin pare. Chomo yang the jela gyuk pare.
다 소모해 주기도 소모 체말렙 세오디 주기도 간로기 까오디 주기도 아니 같이자
Khando chema lep the morang ki shokcha karpo the re la pare. Chomo chema lep the morang ki shokcha serpo the re la pare.
라서 아니 ngawang kirangi samlola ra di trung di zoso ni pe ya bo chonsra kirangi samlola chema lebde kunyiga ji shokja re samgide
Re samgime.
re samgi mindu okay re samgi mindu pe bo ya kajina na shokja 말도 chema le da ine chema lebde da shokja ga ji chondo zhao zhou re da je zang ta khoran ni 심나로 라딩이 쇼차레 삼 페이지에 된대로지 삼인게 아니 나와 다다 종디 나로 니초랑기 식된데 싸워된데 신쇠
Sawa parnam
파낭 빼야보 파낭라나 칼로글라서
nam.
따베신 제만이 치로든 삼 파낭라 치우 댕신도라나 불기도라고 하고세
Agosa.
파낭라 치우디 딩기도라 나 풀기도스라 빼야고 총송 아와 투지체 아니 샴바 가르신서 디낭로니
Shimba
망체 신기도 하다 정디 고수소라 쇼자님은 니 신규 아와
Suksan
정디로니 쇼제 신스라 아니 제말렙
Chemalep I already knew that.
제말렙님은 하고 러서 더지체 러서 아와 빼야고 로스라 아니 단다 교랑기 정보든 줄라 아니 렌든데 요 종딜라 가서 교랑
I wanna say
레레
dungaso.
라서 종디 교랑 가서 아니 교랑기 다다 정보든 줄라 아니 렌든데 요
I want to stay safe and keep using sanitizer, wearing a mask, and washing their hands.
빼야고 되게 진 교랑기 라교데 벽에 돈에 파교라이나 하래래 대장안이 대로치 락바
Lakpatu.
락바 라 아니 셈바키우치니 데스 라 라서 토지체 ngawang 토지체 대린 벽에 돈에다 인지게 돈에 항상 야부 로송 아니 교랑기 종디 빼야고 장샤니 디나로네다 직사와 망보신소 교랑기 좀 비로당데 항상에 길라 뺏가사 아니 토지체 ngawang 아니 제마든다 단다사 빼마 니말라 제용 진다나라 아니 칼레페고 ngawang Pyoso number zo toje na ani thiring azugi sa popogi dongdep ke ni thone dongdep loya ti ani jik to ai jema dunda la yang azo nyamdo laryang pu